My name is Christina Nabila. My metric number is 08444, and this is the muscle of gastrocnemius. The insertion for gastrocnemius is Achilles heel or Achilles tendon, and the origin is its femoral epicondyle, but we cannot see. The action for gastrocnemius is plantar flexion. Alright, that's all.
Hi guys, my name is Nindra binti Muhammad Nazri. My metric number is 08521. So today I'm going to present about gluteus maximus. The origin is at sacrum, ilium dengan coccyx, and the action is at semi-rotation and also for extension. And the session is at the gluteal tuberosity and IT max. That's all.
Okay, Assalamualaikum. Hai. So my name is Safi bin Isman. My metric number is 08453. So I will start to the lower limb first. For the muscle that I want to show is the vastus lateralis. So this muscle originally from the brachio trochanter, and the insertion is the what is it? The tibia subversity, and this muscle important for our hip extension. Okay.
Assalamualaikum. My name is Muhammad Arifan bin Azman, and my metric number is 08477. Today I'm going to show you guys about extensor carpi radialis longus. So its origin is from in lateral supracondylar ridge of the humerus, which is here. And then to the incision is at second base of metacarpal here. And then for the action, it's usually involved in raise, abduction and extension.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nalif Fernanda binti Ahmad and my metric number is 08445. So I'm going to show you guys today about the bicep. So for the bicep, they have two areas, which is the long biceps and also the short biceps. So for the long biceps, its origin is supraglenoid buccal and will be attached to radial nerve radial. So for the short bicep, it will be attached to coracoid process and attached to the radial also. And for this muscle, its action is to flex elbow and shoulder, and also abduct.
So guys, this is brachialis. The origin of brachialis is humerus. The insertion is at ulnar tuberosity, and the action is elbow flexion. That's all.
Hi, my name is Sarah Batisha. My metric number is 08566. So today I'm going to tell you guys about deltoid. Deltoid is a factory which is to have anterior, medial, and posterior. So for each origin for that deltoid is different. For the anterior, we have the origin is at clavicle. For the medial is at acromion. For the posterior is at spinal. Scapula spine. So for the incision for all of this is at deltoid tubercle, and the action for this deltoid is for the anterior is flexion, for the medial is abduction, and for the posterior is extension. So that's all. Bye.
So for the upper limb, we have the supinator, which origin is at the lateral epicondyle. The insertion of supinator is along the radius. The action of the supinator is for forearm supination, and the nerve is at the radial nerve.
So hi, so today I'm going to show you rectal femoris. So this is rectal femoris. The origin is at AIIS, which is a inferior iliac spine, and the incision is patella, and we are quadriceps tendon, and the action is for knee extension and hip flexion.
So this muscle is brachioradialis. Its origin is at lateral supracondylar ridge. Its insertion is at styloid process of radius. Its action is elbow flexion, and its nerve is radial nerve.
We can see this is flexor carpi radialis. So this muscle originated from medial epicondyle, or we know as common flexor origin, and also the insertion is the second and third metacarpal. And the second one is, we can see this is the flexor carpi ulnaris. This muscle is originated also from common flexor origin, and sometimes also on ulnar head. The insertion is of fifth metacarpal. So both action of this muscle, wrist flexion and adduction.
Then I'm going to show you semitendinosus. The origin is from ischiatobuclosis, this here, and then the incision goes to the medial surface of tibia here, and then the action involved for this muscle is knee flexion and medial rotation.
Next, I'm going to show you extensor digitorum, which is over here. So the origin of this is lateral epicondyle, and for the insertion is extension of finger, and the action is to extend the finger.
So this is vastus medialis. Its origin is at the linea aspera. Its insertion is at the patella. Its action is knee extension, and the nerve is at the femoral nerve.
Then we go to the gluteus medius. The origin is from ilium, and then insertion is to the greater trochanter, and the action involved is hip abduction and medial rotation.
So next, I'm going to show you tensor facial latae. The origin of this is iliac crest and ASIS. The insertion is IT-band, and the action of this muscle is for abduction.
So for now, I'm going to show you about triceps. So for triceps, we have two sections, which is the lateral head and also the long head of the triceps. So for the long head, its origin is infraglenoid, and it will be attached to radial, and the action of the long head is to adduct, and for the lateral head of the triceps is to adduct and also extension. It is connected to the body of the humerus and attached to radial. So that's all.
So next, I'm going to show you guys the bicep femoris. For the bicep femoris, the origin of bicep femoris is femur, and also for the insertion of this bicep head of fibula, and the actions of this bicep is knee extension and hip flexions. Okay.
So next, I'm going to show you guys about tibialis inferior. So its origin is lateral tibia and also interossseous membrane. So for the insertion, it will be inserted through first metacarpal and metacarpal
medial cuneiform, and its function is for dorsiflexion and also inversion.